So Ashley, say hello to everyone.
Hello, everyone.
Alrighty, so Ashley, one of the questions from one of our followers, they asked, what can I expect during a dental checkup or exam?
Okay, so basically, like, what's a typical visit for us here? So first of all, we're going to start off with all the diagnostics. So taking your x-rays, updating your medical history, full periodontal charting, of course, get your teeth clean, do a full assessment, see what you need, provide any recommendations, education, how to brush, floss, things like that. And after all, we're going to wrap it up with some fluoride varnish at the end.
Awesome. So during this examination, I know they come in, they get the pano, they have x-rays. They always want to know when I answer the phones, why do I need my x-rays? Explain to them why x-rays are so important.
So x-rays are, first of all, we have a legal obligation to take x-rays. We do a full series of x-rays, which is all the different angles, once every 3 to 5 years.
Okay.
And then we do the ones of just your back teeth and a couple localized images where you may have had a problem before, at least once a year. This is important because whenever we have patients who have either a lot going on or maybe they haven't been here in a while, we can't see everything we need to get the full picture clinically.
Right,
so
below.
we can exactly. So we have to look at your mouth and see, okay, what are we seeing? But you may see a different picture when you actually have something on your x-rays. We can see between the teeth if there's something going on, like in the bone area.
Pretty much it's not naked to the eye or visible to the eye, right?
Exactly.
Alrighty, and so Pareo Charting. Patients always ask me about Pareo Charting. What exactly is Pareo Charting? Why is there Pareo Charting? And what's the benefits?
So a Pareo chart is something that your hygienist should do at each visit. You're going to hear the numbers like 1s, 2s, and 3s. Those are typically your healthy numbers. That's what you want to hear when she's calling those numbers out. 4s are usually a sign of inflammation in the gums, and 5 or greater are usually more of a concern, cause of something that we might need more treatment for. So the reason why we do this is so we can see, first of all, what type of cleaning you need. So are we a healthy mouth? Are we going to get a baseline cleaning? Are we going to need a deeper cleaning? May you need laser therapy? All these are going to be important reasons for us to have that tie-in with the x-rays, because with the x-rays, with the Pareo chart, with the exam are all pieces to the one big puzzle to help comprehensively treat you. So the Pareo chart is going to give us a couple of things. We're going to have the pocket depths. Those are the 1s, 2s, 3s. Our second set of numbers is usually going to be a recession. So to tie in with the whole recession and everything that we were talking about before, we want to know that because we want to see how much support and structure is around the tooth. Then we measure mobility, furcation, which is the area between the two roots, anything that involves the overall support and how deep we need to go with our cleaning is really why we should be taking our periodontal.
And then lastly, by @Neil, he asked, does gum recession usually mean perio disease, or could teeth shifting be the cause?
So those actually really can go hand in hand. So if you have someone who doesn't have a balanced occlusion or a balance in their bite, the way their teeth come together, it can cause recession. So it is a form of periodontal disease. However, we categorize that more so as like occlusal disease. So occlusion or occlusal disease is caused from unbalanced or asymmetrical biting forces. So you may be hitting on your left side harder than your right side. So then you have recession over here, or you have a rotated tooth on this side, and that tooth is absorbing a lot of pressure and force, so the gum is going to be pushed down. So yes, recession is a form of periodontal disease because it actually is irreversible gum and bone loss, okay? Lack of supporting structure, lack of support around that tooth, but it can be caused from your occlusion and the way your teeth come together. So they really do go hand in hand.
Alrighty guys, so that is it for this week's video. Stay tuned for our next frequent questions and answers. So again, thank you, Ashley. It was a pleasure having you.
Of course.
Till next time, guys.
Sure. Have a good day. Thanks.
It's lit.